and we are starting shortly. We are just waiting for few people to join in. So I know there are few members in the waiting room. We are letting them in. Just wait for 2 to 3 minutes more. We have considerable amount of people now who have joined in. So let us begin, everybody. So today's webinar is special, and I think with sir's permission, we have also allowed this webinar for other faculties to join in apart from SLPs. Okay, so I have joined from my laptop, Shweta. Can you hear me?
Yes, ma'am. I can hear you.
Yeah. So I'm really happy to welcome my friend Mrs. Arvind Singh, and she being the mother herself of a child who needed help, and she got motivated from there.
Namita, please unmute yourself.
Yeah, can you hear me now?
Yes, yes.
So I'm really happy that Arvind is there. She started her journey not as a professional initially in this field, but as a mother of a child who needed special help. And from there she began, and she took over that passion, and she felt that her learnings from her own experience can help others, and she can motivate others and make others learn. She had a experience being the commerce graduate from Delhi University and in General Electric field for 15 years. After that, she needed help for her son, so she learned herself, and she's so passionate about education. So she also got a degree in education. She is now a licensed brain gym and double doodle play instructor and consultant for more than over 4-5 years. She is a brain gym instructor and conducts these teaching courses across 5 different levels of brain gym across all over India and even abroad. These courses have greatly benefited the numerous participants of her workshop, namely special educators, occupational therapists, speech language pathologists, counselors, and she has also organized brain gym introductory sessions and webinars for teachers in school and in private institute in Bangalore. So she's a founder of Wings Beneath Your Wings. She founded this to help others and teach a lot of professionals on how learning is not only in the brain, okay? So movement also can give us learning. So today I welcome Ms. Arvind Singh for giving us this very beautiful insight into this topic, and we are looking forward to learn from you. And I now hand over the dais to you, Arvind. Welcome. Good morning.
Thank you so much, Namita, for your kind words and a lovely introduction. A very good morning to everybody. As Namita told you, I'm very passionate about learning per se, and I got into this field because of my son who had learning difficulties, primarily dyslexia and dysgraphia. So I had to just, teach myself again, and from the corporate world enter the world of education, which I was in any case very passionate about. So Namita, do you think I can start? Yeah.
Yes. Yes.
I hope everybody is able to hear me, because when I'm sharing my screen, I'm not able to see a lot of people. So, if there's any question or anything, we'll take it at the end. And if you guys can't hear me or can't see the screen share, please let me know.
Yeah.
Just mute and let me know.
Just request everyone to keep sending your questions in the chat box as Arvind is presenting. So we won't disturb her in her presentation, but we will take down these questions in the chat box, and I'll be asking those questions to Arvind at the end of the session from everybody's behalf. All right. Yeah. Thank you, Arvind. You can go ahead.
Okay. Thank you, Dr. Namita. So welcome everybody to the world of brain gym and movement. And today we will see that learning that we all talk about and always are very, very inquisitive, how it happens is just not in the brain. So let's take a deep dive into this. Give me 1 second. Okay. All right. So we'll talk about what is Brain Gym. Brain Gym actually is a movement-based program, and it is a series of 26 simple and enjoyable movements, which help us to think, feel, move, and realize our full potential. Brain Gym was founded by, oh God, okay, was founded by Dr. Polly Dennison and his partner, Gail Dennison. Dr. Paul Dennison himself was unable to read till the age of 9 years, and hence his parents had to change a number of schools for him. However, he didn't give up and went on to do his PhD in silent reading, and founded the Educational Kinesiology Foundation in the late 80s. And thereon, this program has now been running in over 80 countries, and the courses are taught in over 40 languages. Recently, it's been renamed as Breakthrough Internationals. And he's been a pioneer in a field of neurological development. And what he's done is that he's studied a lot of, multiple modalities. For example, the Chinese meridian system, yoga, Tai Chi, acupressure, just to name a few, and then consolidated this program. Also, think of Brain Gym as, like you have a dump truck, which just comes and clears all the roads. So Brain Gym, actually, when we do the Brain Gym movement, it clears all the neural pathways and allows us to access the full brain, and pay attention and move on, and actually open the door to learning. So today, what we are going to do is, I'm going to talk a little bit about our brain, which is a fascinating organ. I'll then talk about how learning happens and what impacts learning. Primarily, we'll talk about movement and play. Yeah. So let's see how our brain is. Well, you see this little boy, and we see that the right hemisphere, which is for famously for all of us, it is the left and the right. So let's talk about the right hemisphere, which primarily develops between the age of 4 to 7 years. And this is the gestalt, or the receptive side, which sees the big picture, has our emotions, music, drama, talent, everything on this side, intuition. And then as we grow up, between the age of 7 to 9 years, our left side starts developing, which is the logic or the expressive brain. And this is the side where we have planning, analysis, mathematics, logic, everything residing. Yeah. So just to know a little bit more about what our brain is, surprisingly, it is 75 to 80% of water. It weighs around 1.4 kgs approximately. And we all know that our brain is plastic. So neuroplasticity is actually the ability of the brain to change, to grow new neural networks and adapt itself via and rewire itself in the changing environment. So that is a very, very big quality that our brain has. Of course, it also has unlimited storage capacity. So that's not been able to been calculated until now. And also it gets activated with movement, and we will see how. It loves repetition. So the more you do, practice, we've all heard practice makes a man perfect. And basically that is because the brain loves repetition. The more we do the same work or the job again and again, the more myelination happens in the brain, and the process becomes automatic and faster. And it has over 100 billion neurons, and these neurons are not all alike. So that is something, to ponder upon. Now, just to, add something here, I have a little activity where you will see that a brain, for us to read, actually, it does not need all the letters to be in the same, format. So let's just go to the next slide, and I would like you guys to read this quickly and just see how amazing our brain is, you know. So the order of the letters don't matter. It is basically if the first and the second and the last letter are at place, we are able to read smoothly. Yeah. So this is according to a research in Cambridge University. It doesn't matter in what order the letters in a word are. The only important thing is that the first and the last letter to be at the right place. The rest can be a total mess and you can still read it without problem. This is because the human mind does not read every letter by itself, but the word as a whole. Yeah. Okay. So let's move on. What I would like you to do is, may I invite you guys to notice a few things, and you could make either a note, you know, on a paper or pencil if you have with you, or you can just do a mental note. Yeah. So just see, how are you sitting in your chair right now? What is your posture like? Are you able to focus on what I'm talking about? Yeah. What are your emotions right now? Are you anxious? Is it boring? I don't know. Notice in case you have any pain in your body anywhere. What are the thoughts that are coming in your mind right now? And how's your breath? Very, very important. You know, how we breathe is very, very important. And if you may, you know, just get up and try and bend forward. So if I was to get up and just, you know, slightly just bend forward and see how far can my hands reach out towards my feet. So I'll give you like a minute or so to do all this, and then I'm going to play a video, and I would like you to just look at this video and again make a mental note how it makes you feel, what is going on when you, yeah. Okay. I hope you could hear the sound and also see the video clearly. You know, Namita, if you can just take a you know, thumbs up because I'm not able to see. I'm sure that everybody was able to do so. Yeah. And what we'll do is I'll go on to the next slide and we'll come back to this and see what happens. Yeah. Okay. Let's move. Okay. Let's talk a little bit about learning, you know, and this is the main topic that we have today in combination with brain gym. So basically learning has three aspects. The first aspect is the physical aspect. So there are certain physical skills that we need to have in place for the learning to happen for any human being. Forget about just a child. For any human being to learn, the physical skills have to be in place. The second part is the emotions, you know, and the emotions also have to be in place for the learning to happen. And the third aspect of learning is the mental aspect. And we will today, primarily, I'm just focusing about the physical aspect of learning because as we go along, we'll understand as to why is the physical aspect so critical to learning. Moving on, you know, let's talk about, so learning here is actually a process which starts from reception, receiving information, and for us to express. So basically it's from reception to expression. So this is our wonderful, wonderful brain, which we just talked about. And it does not just, it just amazes me every day. And the more I learn about it. So we talk about the brain stem, and this is the part which is just above our spinal cord, at the back of the neck. And this is responsible for our attentional skills and for us to receive information. And the primary function is basically survival. That is how the human brain was structured. And it is sometimes also referred to as the reptilian brain. And once we receive the information, the sensory input, it passes on to the second part of the brain, which is the limbic brain or the midbrain, which we call us. And this is the emotional center that we have. And this is responsible for organizing all the information that we receive from an environment. And then pass it on to the prefrontal cortex, which is the left and the right hemisphere that I talked about, and to be able to process that information and then communicate to the outside world. Yeah. So reception to expression. And just going back to this slide, the other thing that I would like to just, say at this point is that, so for example, if you see, so brain stem we consider as, let's say, door number 1, and the limbic brain is door number 2, and the prefrontal lobe is the door number 3. So for us to be able to access and to be able to express ourselves to the world, we need to make sure that the door number 1 and 2 are open, and that's only then do we have access to, to make sense of that information, to process it, and to be able to connect with the world. Yeah. So if this last door, has to be accessible, then the door number 1 and 2, which is receiving of the information and second, organizing of the information, becomes extremely, extremely critical. Now, taking a little bit more deep dive into the learning process. Okay. So I'll just quickly talk about just the survival brain, which is the brain stem. I did mention that it looks for our safety and security, and always telling us that I am safe, because that is the precondition it has. It is also responsible for all the automatic processes like breathing, digestion, heartbeat, etc., all the reflexes that we have, and our ability to focus. Let's look at, at the learning process now. And here, what I would like to add surprisingly is our little heart as well, And so the learning process starts right at the left top corner, where you see the sensory experience that we have, and that is received by our brain stem. Yeah. And it activates the reticular access system. And this information is received from us, by us, through all the senses that we have. Yeah. And then we see our little heart over here. And what the heart then does is that it actually secretes two very, very important hormones, the ANF and the ICA. The ANF is the arteonatriuretic factor, and this is responsible for affecting our emotional state. And the ICA is responsible and regulates the the synthesis and the release of the dopamine, yeah, and the adrenaline. So what happens is, as soon as we receive the sensory input, it is received at the brainstem level, the heart sends out a signal, a neural signal, to our midbrain, which is over here, the limbic system, and informs the the amygdala that everything, if that is, we are in a calm state, that everything is okay, and you need to function at a parasympathetic state level, which is we feeling secure, relaxed, and happy. It also sends out the signal to thalamus to easily take in and receive in all the sensory input that we are receiving from our environment, and at the same time sends out a neural signal to the frontal cortex saying that you need to be ready, we are we are in a coherent state, and allow to form those patterns in the brain and fully understand the information and then be able to express it. Now, what happens is, and probably that is why, there's a saying in Hindi, ki dil laga ke padho ya dil laga ke sikho. And that's why we know. And the reason for that also is that there is more neural fiber going from the heart to the brain than vice versa. Yeah. Okay, now let's see what happens if we are in stress. Now, if we are in stress, the brainstem has, kind of getting all this sensory input from the environment. However, the little heart over here sends a signal to amygdala, and will just tell it to function in a sympathetic state, and the flight and the fight mode is activated. Yeah. The thalamus is also sent a signal to shut down and not to receive any sensory input which does not relate to safety at that point in time, because that's a primary concern of the brain. And the prefrontal cortex at that time also receives a signal, which is that there's incoherency, and as a result, the sensory input the information does not reach the prefrontal cortex areas at that point. And even if some of it does reach, it cannot make sense of it. And there is utter confusion. And there is a break in our learning process. Now, so that's why the heart becomes very, very important. And also, that's why we say that the brain listens to the heart, and learning also happens with movement and emotions at place, because our motivation has to be there to learn anything. Okay. Let's see now. What are the physical aspects of learning? Because, as in the previous slide, I was talking about that there are certain physical skills that need to be in place for the learning to happen. And here now I'm going to talk about, so we are, most of us know that there are 5 primary senses that we have. However, there are 2 more, sensory systems which are very important, the vestibular as well as the proprioception. So let's quickly have a look at all these 7 aspects, of these 7 senses that we have, and how they affect learning. Now, hearing is something which is very, very important. And this is a sense which develops very quickly. And a fetus is able to hear only at 23 days in utero, right? So we've all heard the story, that Abhimanyu knew how to get inside the Chakravyuh, right? So the fetus is able to hear, and it is now scientifically proven. Now, at 5 months, a child, the fetus which is there, is also able to hear and make sense of the phonemes of the language which is spoken by the mother. And there are a lot of sounds that a fetus hears, which is the heartbeat of the mother, the blood flow, the digestion, the voice, also, and hence any damage that happens to the hearing mechanism, actually leads to inaccurate imitation of the sounds and difficulties, and are likely to foster dyslexia, and especially, consonants which are voiceless, or what we also term as nasal sometimes, like the M and the N, and the sound is and become very, very difficult for a child to understand or make sense of. Coming on to taste, which is our next sense, it is related very deeply to our memory, and it also takes us back to the place where we would have tasted something. For example, if you have a laddu, you might just be reminded of your grandma's home and her kitchen, where you would have, may probably stolen one as a child. Yeah, smell again is one of the a very important sense, as it alerts us of danger. And we all know that animals like dogs and tigers and lions are, they mark their territory by urinating. And also, it gives us a sense of grounding. And there is a development expert in one of a German developmental expert. He says that if you rub your nose, and then you sit and learn something or try and memorize something, it is going to assist you tremendously. So, that is something which was absolutely new to me as well, but turns out it's true. Let's talk a little bit about our skin, which is the touch. Now, skin is the largest organ that we have in our body. And, it is responsible for early environmental learning. That is how we all learn. If we see children, they're always wanting to touch everything, right? And and that's where the parent and child interaction becomes very, very important, because touch and play actually lays down crucial, I would say, foundation for cognitive development in future. And it is a very, very strong anchor between behavior and learning as well. Now, touch combined with the other senses, you are able to activate the brain much more. And we also all heard about the Jadoo Ki Jappi. Yeah. That was taught to us in a very, Bollywood fashion. However, it is true, because touch is something, the Jadoo Ki Jappi actually, releases oxytocin, which is a feel-good hormone. It makes us feel loved and secured. So very, very important. Coming to our vision, actually, vision is a very, very complicated process, and only 5% of it happens in the eye, and the rest 95%, in fact, more than 95%, happens in our brain. And for our vision to be in place, the senses of touch, hearing, and proprioception become very, very important, and they have to be in place for us to be able to see properly and to have the visual acuity, where we are able to see the colors, the shape, we have the depth perception, we have binocular vision. Yeah. Moving on to now, so these were the primary 5 senses that we talk about. And then I am going to be talking a little about the next one, which is the vestibular system. Now, interestingly, vestibular system is a system which develops, one of the sensory systems that develops almost, is almost myelinated. The myelination starts around 5 months in utero. And the child is very, very sensitive, because the mother is always moving, and that sense of balance, starts kicking in. Now, it also decides our ability, how we are able to move and act, in gravity, and how we are able to develop that sense of balance. Now, vestibular system, interestingly, is the entryway to our brain. For any new learning to happen, this system has to be in place. And this gets activated only once when we move. And we see kids moving a lot, right? They're always running, jumping, rolling, going on in circles, swinging, rocking themselves. And what are they doing? They are just activating their vestibular system. And this sense of balance which gets created, they're able to then move at will, which we term as locomotion, right? So movement on will is called locomotion. And then we come on to proprioception, and this is the sense of the body, of itself in space. So this is me and this is you. So that is very, very important for us to understand where we are in space. And proprioceptors, as we all know, are like little sense organs, which relay information about the position, the tension and the activity of the joints, and how the balance is over there. And these are located all over our muscles, tendons, and joints, and the mechanism inside the inner ear, which is the vestibular system, interestingly. And the proprioception gives constant feedback to the brain, to be able to readjust and adjust. Let's say we are reading, so what does it do? It keeps on sending the feedback as to how we need to, readjust our shoulders, our neck. And this allows our eyes, to be able to be at the reading level and to be able to successfully read, or to probably sit down in a chair for a long time. Okay. So this was all about the physical aspects which need to be in place for learning to happen. Now I'm going to move on to the most interesting part again, and this is related to the movement. Give me a minute. Okay. So when we talk about movement, and what Dr. Polly Dennison says, that movement is the door to learning, and that learning is not always, learning and thinking is not always in our head, which is the primary topic also of our presentation today. So body plays a very, very important role, in the intellectual process, right from the point we are born and all through our age to the old age. And the first movement, that develops in utero is about 9 weeks, and it's called the Moro reflex. And this is the reflex where, the startle reflex, where the hands and the legs, go out towards the, the extremities, and the child is just startled. Now, there are a number of reflex which keep on developing, and as a child is born, even in utero, and as a child is born, and what happens is that all these reflexes integrate into higher order movements, right? So let's see what happens now as a child is born. So there are some reflexes which developed in utero, Moro reflex to be one of them. And then the child is born, it's after a few, maybe a month or so, starts rolling over, on the stomach, lifting the head, sitting down, and then gradually crawling, standing, and walking. So as all these movements keep on happening, the child keeps on stimulating the vestibular system, keeps accepting the new learning, and these reflexes get integrated into higher order movements, for example, which would be like running, jumping, jogging, skipping. So these are all higher order movements. And in case some of the reflexes do not get integrated, they leave that movement map blank, spaces which are blank in the movement map of the child. And the child is always seeking that attention or that movement, how to complete it. And can lead to situations where they are with learning difficulties, or they are labeled as ADHD. And what we see is that, so Dr. Carla Hannaford, which is a very, very senior brain gym instructor and has been in this field for over 45 years now, she did a research, wherein she studied in depth the Danish, Swedish, and the German forest kindergarten schools. And what she saw was that these kids, all between the age of 2 to 6 years, went to school every day, whether it's sunshine or rain. They would just get up, go to the school, and what do they do there? They just move. They're climbing rocks, they are jumping, they are climbing ladders, rolling down the hills, walking on the logs. And what was happening all this time? They were just singing, playing, and moving. And this developed their vestibular system. And when that enough development, the vestibular system is fully developed, that is the time a child is ready to learn and is ready to sit calmly. And that is what is required in our schools. It's very unfortunate that, in our education system, we do not understand the importance of movement. But today, we have this information with us, and that's how brain gym can be introduced, with our clients or students or even adults, because it helps you to bring down the stress, It allows you to learn and stay coherent. Let's talk a little bit about playing now, because playing also is a very, very serious business. And Fred Rogers, a very famous TV personality, he says that children's play is serious learning, and when we talk about, play, I have a little video clip and I would like to show you that. And do tell me that you're able to hear the sound, and I just hope it plays, because sometimes, the internet plays up. So I'll just play this up for you and we'll get back to the importance of play then. Are you guys able to hear it? To just forward it so that we can.
What if I was to tell you that a game of peekaboo could change the world? Sounds impossible, right? Well, I'm here today to prove it's not. Hi, I'm Molly, and I'm 7, and this is my little friend Ari. Say hi, Ari. Hi. Oh, and this is my neighbour, Amajot. He has to take Ari away now to get ready for our experiment. But don't worry, they'll be back. My talk today is about some powerful things you grown-ups can do that shape us as children and the adults we become. How do I know? Because my parents and people around me did them, early and often. I know not all kids are as lucky. Some of my friends, some kids at my school, and many around the world. And I would really like to help change that. Thanks to scientists, we now know just how important the first 5 years are for our health and development, especially our brains. Ari started learning long before he was even born, from inside his mummy's tummy. When Ari was born, he was tiny, and he cried all the time. He was always hungry, and he pooped a lot. Now, he laughs and giggles and makes funny noises. But those are just the changes we hear and see. There's way more going on inside. So, let's talk more about our brains. The blue bag is the rough size and weight of a healthy baby's brain at birth. The red one is a baby's brain after the first year. It almost doubles in volume. And by my age, it's almost 90% the volume of an adult brain. Our brains develop faster in our early years than at any other time in our lives. It can create up to 1 million neural connections every second. But we need your help. Our healthy development depends on these top 5 things. 1, connecting. 2, talking. 3, playing. 4, a healthy home. 5, community. All of this helps our brains and us reach our full potential. So what's something you can do that can really make a difference? Scientists call it serve and return. That's just a grown-up way of saying connect, talk, and play with us. And here's the really big news. Amajot, Ari, you ready?
Ready?
Copycat games build imagination and empathy.
And
Naming games build vocabulary and attention.
is it Daddy? Ari, Daddy, Ari.
And games like peekaboo, yep, peekaboo, actually build memory and trust. Each time you talk to us, play with us, make us laugh, it not only builds and strengthens our relationships and mental health, it actually teaches us some of the most important life skills. From making friends, to taking the test, to getting a job, to one day maybe even starting a family of our own. Interactions early and often matter. Take it from me, the 7-year-old up here, talking about brain science. Okay, now, let's see what happens when the connection is taken away. So now he's trying to get his dad's attention again. He's reaching out like, "That was fun, why have you stopped?" I know it's important for adults to use their devices sometimes, but kids are hardwired to seek out meaningful connections. Not receiving them causes confusion and stress. Okay, Amajot, please re-engage.
Ate, sorry. Okay.
Now, what if our whole childhood was like that last 30 seconds? How hard it would be for a child to feel calm, to feel safe, to learn to trust anyone, and the lifelong impact that would have. That makes me feel sad. Ari only reacted the way he did and recovered so quickly because the connection between him and his dad is usually so strong. The positive relationships with the grown-ups in our lives gives kids the confidence we need to try new things, to explore, and be a kid. So please try and remember, the most special period for our development is the first 5 years, starting from inside Mummy's tummy. What's something really impactful you can do? Serve and return. And when? Early and often. Please give it up for Amajot and Ari.
Okay, so as we saw in this video, just talking about play again, play is very, very important because it encourages imagination, it encourages creativity, allows us to explore, new and the unknown. It also allows us to pick up novel challenges and, come up with creative ways of solving them or going through them. It encourages and improves our visual skills. For example, a game of cricket might sound, very, very simple, but it involves a lot of visual, skills which are required. For example, eye teaming to figure out where the ball is, depth perception, to be able to see from far to near as the ball travels from the bowler's hand to coming towards the batsman bat. Also, spatial awareness and intelligence is also improved. In a simple game like hide and seek, for example, to examine your surroundings, where you want to hide in. Are you able to get into that place? Will you be fit? Will your body fit in completely over there? So very simple, but has very, very profound effects. Now, also, this builds a movement, plan inside the brain, allows us to, develop language, strategy, and builds the skill of teamwork, and also creates social bonds, which are very, very important. And the sooner and the better they are, better adults we would, turn out to be, and also we will be able to take in learning. Moving on to the next slide. Let's see what the movement helps in. It helps to integrate and anchor information. It increases the neural connections, and we'll see that in one of the slides coming forward. It stimulates the vestibular system, which I talked about, and that is very, very important because the more the vestibular system is, the more we move, the more the vestibular system is stimulated, the better balance we have. The better balance we have, more, the better the movement becomes, and this cycle goes on and on. It's all interlinked over there. There is full brain activation, and also it helps to increase, our working memory and our reasoning ability. Just to see the next slide here. So these are the nerve nets, which are shown over here for a child at birth, and we see that it's very, very scanty. And as the child is born and starts moving up to the age of 6 years, these nerve nets become really, really strong. And then again, as we progress towards our teenage, since the movement also reduces, the nerve nets slightly go down. And here is a PET scan, from Dr. Chuck Hillman of the University of Illinois, which was taken in 2009. And this is a brain of a person, on the left side, who's been sitting quietly. And as you see, it's not activated at all, just quiet. Nothing is happening. There's no activity. And the brain of the same person, after he comes back after a 20-minute walk, and we can see the amount of activity which is there. Yeah. And what we can do is that, when we do the brain gym movements, we are able to activate our brain, because every time it is not possible to go down for a 20-minute walk. And let's see. Okay. So now I'm going to talk about, a simple process that we do in brain gym. And this is called the steps for learning readiness. And it is denoted by an acronym called PACE, where P stands for positive, A for active, C for clear, and E for energetic. So how we're going to do is now, I'm going to talk about it first, and then I would encourage you and invite you to do the movements with me. So, and this process is actually done in the reverse order. So first we have water, and we energize ourselves. And as we know that the brain is 75 to 80% water, our brain gets activated. So could I invite you all to have a sip of water? And how we have water is we take a sip, keep it in our mouth for about 4 to 5 seconds, and then swallow it down. And as we take it in, we can actually feel the water going down through our central meridian, yeah, and activate the up and down of our body. And also water is very, very important for the neurons to talk to each other, for the electrical impulses to pass, because our body is an electrical system. So being hydrated is extremely important, and the first step for learning to happen. The second step now is what we call as the brain buttons. And I would invite you, I'll just talk about it, and then I'll show you all the steps. So here what we do is we actually stimulate the K27 points, which are on both sides of a sternum, and put the other hand on our belly button. Just rest that hand and move our eyes from left to right. And what this does is that, it breaks the ocular lock, that we have when we move our eyes from left to right, and also activate our lateral midline of the body. It also allows us to send oxygenated blood to the brain, which is again very, very important for learning to happen. The third is the cross crawl. And here what we do is we actually touch our, elbow to the opposite knee, and then do the same thing on the other side. And this actually makes us active, allows us to release any extra physical energy that we have. Also activates not only just the left and the right hemisphere of the brain, but also the left and the right side of the body totally, And the last one is positive. And how we do this is we do something called as the hookups. And these are very, very powerful. And I'll just show you in a minute how this is done. And what the hookups do is it makes us absolutely calm and coherent, because as soon as we touch, the tongue to our hard palate, it activates the ligaments in the tongue, which stimulates the vestibular system, and again activate the RAS, and allows us to be attentive, pay attention, and get the sensory information in. And the part 2 is where we just join the tips of our hands, our fingers, and we breathe. So these are the 4 steps that we have for PACE. and extremely, extremely important for us to be able to receive a new information and learning coming in. The second, we'll do one more movement. And what I'll do is, can I just stop the share for a minute and just do these movements? Is that okay, Namita, quickly? Okay, so can I just spotlight myself, and could I invite you all to please have the water with me if you haven't had it? So you hold it in your mouth and then take it in. And then let's do step number 2, which was the brain button. So what we do is we make a C with a hand and place our hand, one hand on the belly button, just let it rest comfortably. Yeah. And then with this hand, this is just above, on the K27 points on both sides of our sternum. Yeah. Just above the first and the second rib. These are very soft indentations, and we stimulate them gradually. And while we are stimulating these points, we move our eyes to the left and the right very, very slowly. We do this for like 8 to 10 seconds. And then we change our hand. Yeah. Same, the eye movement is left to right. Yeah. So the brain buttons are done. We are now clear. And now what we're going to do is we are going to do the cross roll. So wherein we touch the elbow to the opposite knee. Yeah. And come in a little bit. Yeah. Like this. So you could very, very slowly and gently, maybe 7 to 8 repetitions we will do. Yeah. And now we are going to do what we call as the hookups. Now for this, what we are going to do is we are going to cross our legs. We join our hands, thumbs down, cross over, interlace our fingers, and bring the hand up to the chest. So I'll quickly show it to you. Thumbs down, cross over, interlace, and get your hands towards your chest. And we are going to breathe now. Now, as we breathe in, we touch the tongue to the palate of our mouth. And as we exhale through our mouth, we relax the tongue. So let's all take 3 deep breaths. So breathe in and slowly breathe out, relaxing our tongue. Breathe in again, touching the tongue to the palate of the mouth and relaxing the tongue and breathing out. One last time, breathe in, touching the tongue to the palate of the mouth and exhaling gently, relaxing the tongue. Now we softly and slowly unhook ourselves and then place the tip of the fingers, join them together. And again, we take 3 deep breaths the same way we took the last time. Breathing in, touching the tongue to the palate of the mouth and relaxing the tongue, breathing out. Breathing in, touching the tongue to the roof of the mouth and exhaling, relaxing the tongue. One last time, breathe in and gently breathe out. So this completes our process of pace. And I'm going to go through one more movement of brain gym, which is called the elephant. And here what we do is we stick our ear to our shoulder and put the hand ahead, slightly bend our knees, yeah, like this. And then make a lazy egg going left up and looking ahead through the fingers far away. Yeah. And back to the center. One last time, left up and then right up, back to the center. I go back, do it exactly on the other side the same way. Bend, start left up, come to the center, right to the center, left up, back. And one last time, left up, to the center and to the right, and to the center, back. So this is called the elephant. This movement again, activates our vestibular system and also activates the whole body and makes it ready to learn. I hope everybody was able to follow the movements and do them and experience them, because, as Einstein says, learning is an experience. Everything else is just information. So I would have wished, and I hope that you guys all experienced it and embody the learning that we have today. So this was the elephant that we just did. Yeah. And so, well, now what I would like you to do is, again, going back to what we did, please notice, how are you sitting on the chair now? What is your posture like? What is your ability to focus? What are your emotions right now? If at all you guys anybody had pain, how is that pain now? What are you thinking? And how's your breath now? How are you breathing at this point in time? And if you could quickly stand up, for those of you who checked, stand up and just bend forward and see, is there any change? Anything that you notice which is different now, vis-a-vis the first time that you did it? And I'm going to play the glitter jar again, and I would want you to notice, what do you see this time as you look at it?
Arvind, please put it full screen.
Sorry?
Full screen.
One second. Able to do it. It's not allowing me, Namita.
Okay.
I would, if you could all share your experience of what you noticed this time on the chat box, it'll be great. Just share, what did you notice when you did the same activities this time around than what you did the first time around? So if you could just put a note, on the chat box, I think it'll be really great, and it'll encourage others also to share. Yeah. Okay. And maybe does anybody want to talk about it? You can unmute and maybe, okay, so I have a comment here.
Yeah, if any participant wants to talk about the experience of first time and second time, they can unmute, raise the hand, we'll unmute you.
So I think Mitali has put something here. Dr. Namita Joshi also put, she saw colors and was more soothing. Mitali says it began with colorful small beads turning into bigger and blacker. Could bend down further. Yeah, that's what Piali says.
Yes.
Could see red dots and some figures forming. Shalini Singh says increased heart rate. Shubhangi felt more dense, colorful, and vibrant. Thank you all for sharing. Thank you. Okay, so others can also, keep on putting their experience, what they had, and we'll talk about it. And this is, well, my the theory part, the last slide, where we talk about why do we do brain gym. I talked about movement, and I talked about learning, and I talked about play. Well, brain gym is a program. It actually allows you and gives you the permission to play and move, which is very, very important. And it's a very, very simple program and can be done anywhere. It resets the brain and allows full brain learning to happen. It also gives us a safe and secure learning environment. And as I mentioned, the first and the foremost concern of our brain is our safety and security. And it's only when we feel safe, and of course, then we go to the emotions that we feel happy, that the learning really happens. We are able to make those neural connections and put the learning into our memory systems. And that's where brain gym becomes very, very important. It allows us to also develop the movement map for stability. Remember, I talked about balance, which is very important, locomotion and hand-eye manipulation. These are all skills needed by us in everyday life. It improves the ability to focus, again, balance our memory and physical, and there's better physical coordination that we experience. It improves organization and communication skills also for us, and gravely helps in reducing stress and anxiety. So the hookups that we did actually make us absolutely coherent, because when we, join our hands, interlace the fingers, get them back and cross our legs, what we do is we get the attention from the peripheries back to the midline of our body. And that's when we are absolutely calm and ready to receive anything that is coming our way. Extremely, extremely important. So this is moving on. I have an interesting read. If any of you would be interested, please do source and read Brain Gym and Me by Dr. Paul Dennison. This was his first book. Also, if anybody would like to have more information on the courses and the International Brain Gym certification, and about these 4 courses that I run, 104, which is talking about all the 26 movements in depth, Brain Gym 101, which is balance for daily life, 105, which is double doodle play, one of the most playful movements in Brain Gym, and 110. So you can, my number and my email is here. What I would say now is that thank you all and keep moving. And this was all from my side today. If you have any questions, please put them in the chat box. And
they can unmute and ask as well, Arvind.
Yes, you can unmute and ask as well. Thank you so much. I hope this was an enriching experience for you and you guys did experience all the movements within your body. Just remove my spotlight.
So questions, anyone? We are open for question and discussion now if anyone wants to. Yeah, Neha is asking about how to implement these in our daily routine as an SLPs.
Okay, so Neha, what you can do is you can start, by doing PACE itself. The PACE, the 4 steps of learning readiness, PACE is very, very powerful because you are hydrating your brain, because I mentioned the brain is 75 to 80% water. Water is very, very important for the neural connections. I'm sorry, for the neurons to talk to each other, to pass on information, because our body is an electrical system, right? So it is like, the charger to your battery. So the same way we charge our phone, we can charge our body and our brain by having water. Very, very important. Second, when we did the brain buttons, it actually, activates your lateral midline of the body and also sends out, that clarity that we need in our brain. Also, removing all the cobwebs that we call, Third, when we do the cross scroll, we are actually activating the front and back of our body, right? And also the left and the right hemisphere. Very, very important for learning to happen, and release any extra energy that we have, not required, allowing us to sit still and pay attention to. And last of all, and the most important, the hookups, part 1 and 2, because what we need, remember I talked about that slide on the learning process, that when the heart sends a message of coherency, so the hookups make you coherent, absolutely coherent, calm, quiet, relaxed, and ready for that learning to happen. And another important thing is that the hookups activate your vestibular system, which is very, very important, because that is the entryway of learning to happen in our brain. So start with hookups. The entire 4 steps of PACE, having water, doing the brain buttons, cross scroll, and the hookup. So you can start with that. And in case you're interested, there are other movements which can be very, very easily, taken up in our daily routine. And we can do.
Arvind, they are asking, can you expand PACE and how many times do we repeat these exercises?
Okay, so I think I expanded. You mean the expansion
The
of
short form, yeah.
acronym?
Yeah.
Okay.
The full form,
So
yeah.
P stands for positive. Because we did the hookups, we become positive and coherent. A stands for active, wherein we did the cross crawls. We had that physical movement in our body, activated our left and the right hemisphere and the left and the right sides of our body. C stands for clear, wherein we stimulate the K27 points. These are, just above the catroid arteries, where they split and go to the brain. And that's how, when we stimulate them, the freshly oxygenated blood reaches our brain and allows us to become clear. Yeah. And lastly, E, which is, energetic, which was the first step where we have water and we get that gush of energy in our brain. Yeah. And also, yes, how many times? So I would say, if you are, you can start your daily life with doing pace. In case when you're seeing your clients, students, start the session by doing pace. And my suggestion would also be that when you encourage your client or your student, to do pace, you do the pace with the person also, because that gets you also, that makes you coherent as well, and also receptive of all the information that will be coming to you. And there is no age requirement. You can do pace from a small newborn child. I mean, yeah, from a small child to 99 years. Everybody can do it. There's no restriction. Also, you can do it passively as well. If a child is not able to do it, you can do the pace passively also. So you can stimulate the buttons, and put your hand if the child is not able to do it. You can do the cross scroll for them, and you can sit down also and do it. You don't need to stand up and do it also. So that's another variation. The only thing I would like to just quickly add one thing is, one thing, Dr. Namita, that I wanted to add before I forget. In case somebody has history of, epilepsy, in that case, that's the only one situation where you stimulate one button and then go to the other button. Do not stimulate both the points together in brain buttons, because there'll be too much of brain activity then. So that's something you need to just take care of.
Yeah, that was a second question following. Like, what is the age do we do these exercises from, and are there any restrictions on some patients? So that was the next question. That's why I was.
Yeah. So age I answered, and what restrictions? Epilepsy. That is something that you need to take care of. But I do know from our very, very senior instructors in the US that even if somebody has epilepsy, they do take permission from the parents. I would suggest it's always better to take a precaution and not indulge in it. If the parent is okay, it's fine. But then otherwise, just stimulate one and then the other button. Any side, left or right, it doesn't matter.
Okay, and one more question, Arvind. I think probably this will be our last question to take for this webinar today. If there is any tone issues, like if the child has hypotonia, so what could be the situation in terms of when we do the pace with the child? Like, can we do the pace still, or should we not do the pace with children with hypotonia or something?
You can absolutely do it. I think the only issue will be that you might have to do it passively or help the child. So that can be absolutely done.
All right. So in case of children with spectrum, can it be complementary to sensory integration is the next question by Meenakshi.
Absolutely, because for example, and also, sometimes, so PACE is one, the 4 steps of learning readiness. These can also be used individually. So let's say with kids with spectrum also, if they are, too hyper, or they get excited, you can ask them to just simply do the hookups and you will see that they'll calm down. Yeah. So absolutely, you can do all of them with them as well. And it will, because especially the hookups activate the vestibular system, and that would in turn activate the RAS to get in the sensory inputs. Yeah. So it's very, very helpful.
Yeah, that was a wonderful, wonderful session, Arvind, and thank you so very much
Thank you
for
so much.
accepting our invitation from Isha. And everybody here, I'm sure they are, giving the wonderful seminar and webinar notes in the chats. You must be reading them. And there is a request, if you could put your contact slide again up so that they will be able to contact you in future. So can you put that slide up right now so that they'll be able to take down your
Thank you
contact
so much,
number
Dr.
and
Namita.
email ID? And I want to share my personal experience after learning brain gym movements from Arvind. We recently had a brain gym workshop done by Arvind for my whole team of Samparki Polyclinic, both the branches. We are almost around 12 people together did the brain gym workshop with Arvind. And as an SLP, so we used to have this parents also have this understanding, and even few years back we also had the understanding like, okay, sit and do the activities, okay, sit and listen to me and follow the oromota movements, or sit and do the language and cognition games with me. But after Arvind has taught us this brain gym 26 movement, which is the 104 course, which we all did in Samparki Polyclinic, so what we have realized is now we make the child do this, pace. Simple technique what she's taught today is pace. There is much more to learn from Arvind, and you can do the courses and learn from her. But the pace technique has worked even on me as an adult, not only on my children who are having spectrum or learning issues or having any sort of speech language communication or cognition disorders, not only on them, even on parents. We do it as soon as the parents enter. We do it ourselves between the session, and we also do it with children, and we have seen a drastic difference in our child or children who have hyperactivity, who have speech language delay, who have cognitive issues, who have learning issues, everyone. And it is working wonderfully. People who had sensory issues, who would not let us touch their mouth or face or even hands, now they come and sit in our laps, and that has happened just in 1 month's time. And we are Arvind, I know I'm supposed to send you 3 case studies, and I'm going to do that very shortly. But yeah, those case studies are like miracles, and we really, really feel blessed to have Arvind here, who has taught us this, and we're looking forward to do many more courses. So I thank sincerely Arvind from Isha office and as a Isha bearer. And we are very glad that you've come today and taught us. So I request everyone to please switch on their videos for just 1 second for a photograph, please, with Arvind. Just for 1 second.
Thank you so much, Dr. Namita. I'm so glad that you all are practicing and you can see the results. I
Yes.
do pace myself, even before this presentation, just to be calm, because we all forget. Remember, everybody says, oh, I knew this answer. Mujhe to aata tha. Why could you not do it? Because at that time, our brain was not functioning properly. So if you do pace, you're calm, coherent, you're able to, just recollect and reproduce what you wanted to do.
Everybody, please smile. Arvind, please smile.
Thank you.
Cameras on, everyone. Please smile. Give a thumbs up if you want to. Yes, thank you. Thank you so much, Arvind, and thank you so much, everyone, for joining in.
Thank you.
Please give your feedback on the groups, people, so that next time everybody else will also feel motivated to attend such webinars from Isha. Thank you, Piali.
Thank you. This was amazing,
Neha.
actually, Arvind. This is something that I have been wanting to do for a long time.
Yeah.
And what Namita said actually, kind of doubly made me motivated to get in touch with you, because this is something which we need to do with our children. Amazing. Thank you so much. Loved
Thank
it.
you so much. And my only urge, I would urge everybody to at least practice it, because till the time you do not do it and experience it, I could maybe talk for 10 hours. It's of no use. So please follow Einstein. Learning is an experience. So I hope everybody experienced it and keep moving. That's what I'll say, Yeah.
Yeah, thank
This
you
is a
so
very,
much.
very powerful tool.
Yeah, have a lovely Sunday, everyone at home, and thank you for joining us. Thank you, Shweta from Isha office, for arranging everything this webinar.
Yeah.
See you, everyone.
Thank you, Namita and Shweta, and thanks to everybody.
Thank you. Thank you, Arvind.
Have
It
a
was
good
wonderful,
Sunday.
as always.
Bye-bye. Thank you.
How can we connect with Arvind, ma'am?
Sorry?
how can we connect with Arvind ma'am for
You have
future
got her
requirements?
email ID and contact number. She shared the
Do you
last
want me
slide.
to share that slide again quickly?
Yeah,
Yeah,
yeah.
please.
Can you
Yeah,
Please
please
do.
I'll do
share
that.
the slide?
I'll do that.
Yeah, yeah.
Yes.
Sure. Thank you so much.
Yeah. You're most welcome. Thank you. It was a pleasure.
Everyone click a photo, whoever wants
Yeah.
a number, and
Yeah.
Yeah, you
Done,
can
done.
take
It
a
was
picture.
it was a very motivating presentation, and it was such a lovely thing to have you, Arvind ma'am.
Thank you. Thank you.
Thank you.
Appreciate it. Thank you. Yeah.
Thank you so much.
All right. Okay.
Thank you.
Thank you. Thank you, everybody. Bye-bye. Thank you, Dr. Namita, again. Bye-bye.
Yeah, thank you, Arvind. Thank you.